I'm Ashlyn.
And I'm Cameron, and we are surgical techs at Dermatology Partners.
We are following up in regards to your recent surgery. If you are viewing this 24 hours after your surgery, then it's time to change your dressing. To change your dressing, gently clean the area with warm water and soap that is free of dyes and scents, such as a Dove soap bar.
Once your wound area has been cleaned, it's free from blood and no longer has a dressing. Use a Q-tip to place Vaseline directly on the wound and suture line. If blood has dried over the wound site, take a piece of gauze and soak it into hydrogen peroxide. Then place the gauze over the wound site and hold it until the blood softens. You may then use a Q-tip dipped in hydrogen peroxide to remove the blood from the wound site. Use a Q-tip to apply Vaseline to the suture site once the blood has been removed. You will need to continue the same routine of dressing changes each day until your suture removal appointment. The majority of the time, we use dissolvable sutures, which do not require removal.
If you're experiencing drainage, redness, or light bleeding, please refer to the wound care instructions that were provided to you. If you're experiencing bleeding that is soaking through your bandage or running outside of your dressing, hold direct pressure 20 minutes on, 20 minutes off the site. Continue this rotation for about an hour. If it does not stop bleeding, contact the phone number referenced on the wound care instructions.
If you have any general questions, please contact our office at 215-321-3500.
Thank you for trusting us with your dermatological care.